Dr. Stephen O'Day is director of the LA Skin Cancer Institute at the Beverly Hills Cancer Center. He's in studio with me right now. We were just watching this, and I said to you, even with a sunscreen, would you go sit out at the beach?
No, I mean, the major public health message is sunscreens are really a backup to the primary prevention, which is avoiding the midday sun, seeking shade, using protective clothing. Because unless you use sunscreens correctly and apply them liberally and reapply them, you can actually increase your risk by staying out longer than you normally would have and not applying properly and burning anyway. So sunscreens are tricky. They certainly should be used if you need to be in the midday sun, but they have to be used properly or they can turn and backfire.
Let's talk about these new numbers. The fact that young people are seeing an increase six-fold over 40 years ago. First of all, it's alarming on the face of it, but why?
So the magnitude of this is alarming, but we've known for a while this is the fastest rising incident cancer in the last 30 years. So we've known that, particularly more recently in middle-aged men and young women. What this study from Minnesota shows, in a group of 18 to 39-year-olds over 40 years where they follow them closely, the rise was six-fold and eightfold in young women and fourfold in men. So what's particularly alarming is the magnitude of the rise in women and the correlation that we know that behavior in young women and tanning booth exposure in particular is likely a big cause. It may not be the only cause, but it's certainly a big concern.
Well, and that's what we're looking at right now is the tanning booth. Now, these moles that we're looking at right here, if you were to see those as a physician, what would they tell you?
Well, certainly any mole that's changing or has irregular borders or has color variation or is bleeding are very, very suspicious and need to be evaluated. But I think what the public needs to know is that most melanomas don't arise in existing moles. Having multiple moles puts your whole skin at risk for melanoma. So any new lesion, whether it's in a mole or not, needs to be taken very seriously.
Is it just the tanning booths? Why all of a sudden? I mean, these numbers, when you talk about them, 40 years is not a long period of time for it to go up 6 times.
Yeah, but with each decade during these 40 years, the rise was substantial and probably paralleling the use of tanning booths, which in the last 10 to 20 years have been rising exponentially. And it seems to be that exposure to tanning, ultraviolet radiation, which was felt to be theoretically safer than natural sun, you can get up to 7 times the amount of ultraviolet radiation in these tanning booths as normal sun. And the younger you are, paradoxically, the more susceptible your DNA is to damage. And so younger men and women or kids who get exposed to tanning booths, the risk is even higher. And one study showed recently that if you frequent tanning booths frequently, that your risk can increase up to 75%. So it's very alarming.
How alarming is it to get that you have melanoma diagnosis?
Well, I'm a medical oncologist who deals with the disease once it's caught and then unfortunately when it spreads. It represents only 4% of skin cancers, but 80% of the deaths. Unlike squamous cell cancer or basal cell cancers, which are a huge problem, they don't tend to metastasize, whereas melanoma spreads very early. So unless it's caught very, very early, the death rate is extremely high once it metastasizes. But we have, in the last 2 years, had 2 major breakthroughs in terms of new drugs targeting the melanoma cells as well as the immune system. And even patients now with advanced melanoma have a lot more hope than we had even a couple years ago. So we're doing better.
Well, let's talk about that a little bit. I think people, if they get the diagnosis, you know, you have a bad mole or you have some sort of skin cancer, you think, oh, I'm just going to go in, I'm going to get it taken off, and boom, I'm good to go again.
So it's a big shock because that is the normal approach to squamous cell or basal cells of the skin. It's just a surgical operation. They go on with their lives. Unfortunately, the melanoma diagnosis, not only do they need a much larger surgery, they have to have their lymph nodes evaluated, sort of like breast cancer, and then they have to wait and see whether it metastasizes. So it's a really high stress. It doesn't end at the initial diagnosis, but for the first 5 years, they're at high risk for distant metastasis.
How successful are these drugs you were just talking about?
Well, so one of the drugs, an immune-stimulating drug that actually targets your immune system, not the cancer, to kill the cancer, 1 in 4, 1 in 5 people with widespread melanoma are now living beyond 2 years, and some of those beyond 5. So it's a huge breakthrough. The other drug is a drug targeting the cancer directly if it has a certain genetic mutation, and a lot of dramatic shrinkage of tumors, and we're waiting to see whether those patients will do well long term. We're very hopeful, though.
One piece of advice you could give people when it regards the sun and or tanning beds?
It's early sun exposure. Almost 80% of your lifetime sun exposure is before the age of 18 if you work indoors. Your parents, you've got to protect your children at young age, and adolescents and young adults, you've got to be aware of the risks of sun. It's like the cigarettes of the 50s and 60s. This is a carcinogen, ultraviolet radiation, particularly in young people. It's a very hard message to get through to them, but if you can protect your skin at a young age, you have a much better chance of not developing skin cancers later.
Doctor, thank you so much for coming in.
My pleasure, Colleen.
All right, we will be right back.